Hello. Today I am going to be speaking to you on the topic repositioning bed-bound patients. This is a staff in service training. My name is Ada Taylor. I am a student at ECPI University Online, and this is my senior practicum PowerPoint. Introduction. Definition of bed-bound patient. According to Rutland et al. 2023, a bed-bound patient is someone who is unable to change their position independently, safely, or comfortably, and is confined to their bed. A person can be confined to bed due to injury, illness, weakness, limited mobility, or elderly. What is repositioning? Rutland et al. 2023 also defined repositioning as moving a patient to a different position to relieve pressure on the body. Importance of repositioning. According to Ablisi et al. 2022, repositioning prevents pressure ulcers, relieves pain, improves circulation and comfort, decreases the risk of complications such as pneumonia and blood clots. Immobility and other conditions can increase the risk of pressure ulcers and lead to complication as stated. Repositioning allows the lungs to expand fully, keeps fluids out of the lungs, and prevents atelectasis, which is a collapsed lung that impedes gas exchange, and it can also lead to pneumonia. Pressure ulcer is caused by prolonged contact or friction on specific points of the body, either by the individual's own weight or other mechanical surfaces like the top sheet covering the patient. That is according to Cortez et al. 2021. Common patient positions include supine, which is lying on the back, lateral, side-lying position, chair or Fowler's, which is sitting up in a chair or in a bed, which we call bed-to-chair position. We also have prone, which is a front-lying position when the patient is lying on the abdomen with their face down or sideways. Therefore, prevention plan must be implemented for patients with higher risk of developing pressure injuries. For each position, as shown in the diagram, there is a risk of pressure ulcer formation. The diagram also shows each area on the body where pressure ulcers are easily formed in each position. For example, in a supine position, you have the sacrum, especially you have the back of the head, the heels. In the chair position, the sacrum is also a vulnerable area. And in a lateral position, you have the ear or the hip and the knee area are vulnerable areas. Frequency of repositioning. According to Cortez et al., the standard recommendation for repositioning is every 2 hours. However, the frequency can be adjusted to every 3, 4, or 6 hours based on the patient's condition. Equipment used for repositioning, according to Clark et al., includes draw sheets, pillows and wedges, pressure redistributing mattresses, slide boards, mechanical lifts. The most common equipment that we use for repositioning are draw sheets and pillows. The diagram shows how a wedge is used to position the patient in a lateral position and can also be used to float the heels. The first picture shows how pillows are used to support a patient in a supine position. The next picture shows the proper positioning for patients in the prone position and lateral position. Notice how pillows are used to support the patients and decrease pressure ulcers formation. This last picture shows pressure redistributing mattress. According to Clark et al., 2023, some facilities have incorporated technology such as the pressure redistributing mattresses to provide frequent position changes to prevent pressure ulcers in patients. The mattress inflates and deflates over a fixed time to change the area of the body that is bearing the patient's weight. It is important, however, to make sure that the device is turned on and is functioning properly. According to Cortez and Vasquez 2024 and Ablisi et al. 2022, there are factors to consider when repositioning bedbound patients. You have safety precautions. You want to maintain proper body alignment. You want to avoid dragging the patients or pulling the patients when repositioning, and you always want to check for bare sores. Yes, always check for bare sores before repositioning patients to avoid causing damage to the affected area if the patient is placed on that area. Special considerations are for the elderly or frail patients, obese patients, spinal injury patients. Elderly or frail patients may require extra care when repositioning. Obese patients may need extra supplies, and patients with spinal injuries may not be placed in certain positions. Always check the provider's orders before moving such patients. Guide to repositioning. You want to explain the procedure to the patient, use proper body mechanics, place a transfer pad or draw sheet under the patients, roll patient gently while supporting the head, place pillows or other positioning devices for comfort and stability. The picture above shows a patient with COVID-19 lying in a prone position, and notice how a cushioning device is used to support the patient's body. Hospital policy. The facility where I currently work, CRMC policy number 11858 on pressure injury prevention and wound care states that the registered nurse is responsible for assisting in the prevention of hospital-acquired pressure injuries, assisting with mobility, and assisting with repositioning the patient, including floating the heels. Patients who are unable to change position independently should be repositioned at least every 2 hours. This includes floating the heels. The registered nurse will assess the patient's skin for evidence of or potential for skin breakdown on admission and as the patient's conditions warrant. Understand that the registered nurse, licensed practicum nurse, and certified nurses are all responsible for repositioning patients. Also understand that the purpose for the hospital policy is to guide your practice within that facility. Conclusion. According to Cortez and Vasquez 2024, repositioning is a preventative intervention that nurses use to decrease complications due to immobility. The term repositioning underlines the frequency of change in body position. Importance of regular monitoring. Regular monitoring is required to assess for respiratory suppression, assess for pain, and adjust patient's position. Patients in the prone position has increased risk for suppressing respiration, especially in patients with COVID-19 or other respiratory symptoms. Therefore, it is important for staff to make frequent monitoring. Also, it allows staff to assess the patient for pain and to adjust the patient's position because some positions may be uncomfortable for patients. Lastly, you want to encourage the patient to participate and be compliant with the position change. These are my references, and thank you.